Hi, everybody. Thank you for joining us for this introduction to the HGE Care program for your COPD patients. Today, we'll be providing a high-level overview for healthcare providers and practice managers that will cover the benefits of the program for you and your patients, the initial steps that you need to get started, as well as the workflow you can expect on an ongoing basis. We appreciate your time. We will keep this to less than 30 minutes with questions and answers. So hopefully it will be very informative for you. So the HGE Care program is being offered to COPD patients across the spectrum, from mild to more moderate and even severe COPD. The objective of the program is to track daily respiratory symptoms, to be able to really catch those symptoms and identify those symptoms and make intervention changes so that the physicians can intervene in a timely fashion. As you know, early intervention to the onset of a COPD exacerbation effectively reduces the duration and improves the outcome and the quality of life for the patient. And this overall will translate into fewer emergency room visits, fewer urgent care visits, fewer and shorter inpatient stays. So the great news is that it's simple to use and does provide life-changing results for your patients. Since COPD patients are symptomatic most days, it's challenging for them to really understand, is today really different than it was yesterday? Because of this, they often wait until their symptoms are far worse than they should be before they contact you, and then at that point it becomes more complicated to treat, more difficult for the patient, and really just an unpleasant experience overall. But with HGE Care, patients log their daily respiratory symptoms through a web-based application. They can use their smartphone, their computer, a tablet. Patients without a device can even check in by phone by contacting our contact center, and symptom changes are identified for follow-up, and we'll talk a little bit about this later. It takes less than 2 minutes a day. They get the same questions every single day, so it becomes a habit, almost like brushing their teeth. And you can see the indicators that we look at. Those are down there in the lower right-hand corner. The first check-in is completed during a virtual enrollment with our contact center. We're often asked why this is required, and the reason has nothing to do with technology, really. It's quite simple to set the patient's account up and have them log in and have them download the app on their phone. But it's more important is that we work through with the patients about how to assess their symptoms and correctly report their symptoms through the app. And we go through each symptom. We work with them to understand how to use their peak flow meter. They receive a handbook. They receive a contact number for us to make sure that they can call us if they have any difficulty, not only with the technical piece, but also any difficulty with knowing how to log their symptoms and exactly how to assess their symptoms. So in the first 2 weeks, the application learns the patient's typical symptoms, their baseline, their fingerprint, and does not provide them with any feedback at that time. So the contact center calls the patient during that period to make sure they're reporting their symptoms without any issues. And we stay in touch with them and provide all of the support that they need. Once those initial 2 weeks are complete, the system starts to identify symptom changes beyond the range of what is typical for that patient and provides them with feedback to both the patient and the provider. And while HGE Care is not a diagnostic tool, it helps keep track of the patient's symptoms and identify whether their symptoms are stable over time. So forms of this application have been used over 15 years, and what we found is that patients are incredibly engaged because of the value provided, and that this particular engagement yields impressive clinical outcomes. 80 to 90% of patients check in daily, dramatically higher than most disease management programs. And we attribute this to a combination of the ease of the application to use, as well as the timely, in most cases, same-day feedback that they get from their healthcare provider. So it is a very valuable tool for them. We have patients that have been on service for many years, and you can hear the difference in the way they talk about their COPD symptoms. They're informed, they're engaged in their care, they understand their disease. And that level of engagement links to lower utilization, lower hospitalization rates, decreased length of stay if they are admitted, and the lower number of emergency room visits, because we identify those symptoms, the symptom changes early, and act on them early. We see these patterns across a very diverse group of patients. The average age is over 70, and we've got a mix of gender, race, ethnicity, payer mix, and socioeconomic status, including patients with 3+ comorbidities. So a lot of things going on, and yet we still see that same level of very high engagement. And these results have been replicated across geographic regions, urban and rural, whether they're managed by their PCP or whether they're managed by their pulmonologist. The only difference that we really see is the patients with moderate to severe COPD and or recent exacerbations need more frequent oversight and adjustment from their provider. So as we'll cover in a few minutes, we have 2 levels of service in order to be able to meet those needs. So during a check-in, the patient is asked to report their daily symptoms. They report once in a 24-hour period, and we recommend that this is done in the morning, about 45 minutes to an hour after taking their breathing treatment. But what's most important is that the patient is consistent about their time and find a time that works with their schedule. Again, the same questions are asked every day, so they get really good at this. The application is available in both English and Spanish, and the HGE Contact Center provides support in both languages. All questions require a response to submit, so there's never a time when a provider is asked to consider a partial check-in, and the app checks to make sure that the values are within the expected range, specifically around peak flow meters, making sure that the peak flow numbers are valid numbers. Once the baseline is established, the app provides feedback to the patient. So for Care Light, they're instructed to call their primary care physician, which your practice can triage just like any other sick call. For patients on Care Plus, nurses at the HGE Contact Center will support your healthcare providers by entering a suggested clinical pathway right in the patient's EMR chart. Once the provider has reviewed, made any changes, and approved the recommendations, our contact center nurses will send your instructions to the patient via the app itself. The patient can review those and is required to acknowledge the response. The contact center provides support both to the patient and to your practice. So if the nurses speak to the patient about their symptoms, they will document that in there for you. If the patient calls with questions about their care plan, we will assist with that and coordinate with you. So these are the screens that the patient sees. And during the check-in, the patient is asked to report from 7 to 10 symptoms. Some are follow-up on questions depending upon how they answer them. So it really does take less than 2 minutes. Small number of screens, simple interface, very user-friendly. It is available on both the iOS, Android, HTML, and support by phone. So we cover all of the bases that your patient may be using. Great usability experience, very easy to use, and it becomes a habit. Over 80% of the patients, as I mentioned, are checking in every day. And during the enrollment and run-in period, we spend a lot of time educating the patients on how to report their symptoms.
What if a patient doesn't check in? What happens?
Well, depending upon their preferences and settings, patients will receive a reminder on their phone from the app, a text message, an email, and or a phone call if they've not checked in by their expected time. The contact center also typically checks in for local admissions, transfers, and discharges. We do not expect check-ins from patients when they've been admitted, obviously if they're in the hospital, or if they're under supervised care, like in a nursing home or hospice or pulmonary rehab. After a few days, if they still haven't checked in, the HGE Care Contact Center reaches out to the patient to identify and resolve any circumstances that might be preventing them from checking in. The dog ate my peak flow meter. I got a brand new phone and I haven't been able to download the app, or I can't remember how to assess my breathlessness. And we go ahead and we help the patients work through all of the issues that they have so that they can get back into their groove and continue their check-in. So the feedback that the patient receives is very personal. Some health-focused apps provide feedback based directly on reported symptoms. That's not the case with HGE Care. This app provides feedback about symptom changes when reported symptoms are compared to the patient's own baseline, their fingerprint. Lots of experience, clinical validation, and years of data have helped us understand exactly how to make this happen for the patient. So over years of data across the program, we've seen the same pattern. About 85% of the time, there's no symptom change for these patients. 15% of the time, generally identifying symptoms, those symptom changes, most of those are mild. A few may be moderate, and the reliability of this pattern enables you to predict what you can expect for your practice and plan to meet your practice's needs. All right, so what you see here is a comparison of HGE Care Lite and HGE Care Plus. So the HGE Care Trained Contact Center will handle all outreach, recruitment, engagement, and technical support. No additional work is required from your staff, and the benefit to the patient here is to have access to specialists who do this every single day. What we will do is we will look to you to review and approve the patient list. The list is generated based on claims and/or electronic medical record data, but as the provider, you know your patients the best. You are always able to refer patients that are not on the list, and to review, patients enrolled in the Care Lite are prompted to call your office with symptom changes just as they would for any clinical issue, which makes this part of your existing workflow. These patients would likely call your office eventually when their symptoms escalate. So generally, it's not a change in your call volume, but the goal here is to have them call earlier before the symptoms progress further on into a full-blown exacerbation. For the patients enrolled in Care Plus, those are routed to the HGE Contact Center nurses who follow clinical protocols to suggest a clinical response to be approved by the treating provider. This can be documented in your existing EMR system and routed according to your during clinical office hours, after hours, and holiday workflows. On a monthly basis, symptom trend reports can be made available to you. These can be uploaded into your patient chart. We'll review a sample here in a moment. This can be useful during the patient's office visits to see how the patient is doing and evaluate whether their maintenance medications have their symptoms truly under control. For Care Plus, these reports will include the clinical recommendations made by the provider. You're also able to view your patient symptoms at any time through the HGE Care portal found at within our website. Each provider and staff member will have their own account. If you choose to reference the web portal for decision support, you'll see the patients that are just within your own practice. For patients on Care Plus that have a change in symptoms, clinical pathway suggestions are largely determined by the rescue medications prescribed to the patient. The HGE Care Contact Center nurses reference the current rescue medications and using the ATS-ERS guidelines. So based on these guidelines, the nurses make suggestions for treatment that are forwarded for approval by the provider. This slide shows an example of actions that may be taken based on a level of symptom change and a review of the FEV1. Are there any questions about so far within the presentation?
Yeah, I do have a question. I'm sorry, I was on mute. My question is there ever a case where the nurses would be sending a clinical recommendation to the patient directly without the provider's approval or input?
No, no, no. So that never happens. The HGE contact center nurses make the recommendation, but those are not sent to the patient until they are approved by the provider.
Right, thank you for that. I think I have another follow-up question, but I just lost my train of thought.
So I think it's also important to remember that, so the nurses make these recommendations based on what they believe is, based on the information that they have in front of them, but the providers can always go ahead and change the treatment plan. So the provider who knows that patient the best will always have the final determination. So not only do we not forward anything without the provider's approval, the provider also certainly has the ability to go make those changes, and then we forward those changed recommendations to the patient.
Sorry to interrupt. What about EMR? Can these be documented in the EMR? Because we want to make sure that we're capturing any changes to the treatment in there, so we have continuity in that documentation.
Yes, absolutely. So if we're given access to the EMR, we're happy to work with you to identify the best workflow for your organization. We know that nobody wants to do double documentation. So we do the documentation within our system so that we can show the trends and we can show the treatment. So we also want to be able to work with you so that we can share that information with you, but not ask that you do double documentation. So let's take a look. That's a great segue into our next slide. Let's take a look at one that we developed for another client. So here's a visual illustration of what the document in an EMR would look like when HGE Care nurses suggest a care pathway for a Care Plus patient. The order is placed and routed to the provider for approval, and this includes the symptoms reported by the patient for the day of the symptom change, as well as the snapshot of the patient's baseline symptoms here. So this is a nice summary with the recommendations, and this can be put within your own EMR and then sent off to the provider for approval. So this is how the patient's symptom reports appear in the HGE Care portal. The orange column is the baseline. That's the patient's baseline that's over there on the left. And their daily check-ins show up in reverse chronological order with the most current closest to the baseline. So this is patient Luke Skywalker. And you can see the difference in the symptom change across the top. So green is where there's no change. Yellow is where there's a mild change, orange is moderate, and red is significant. And you can see that up there across the bar at the top. And that is their clinical, that's the trend across. And you can see the baseline there on the left. So there are generally two cases where a practice would want to go ahead and log into the portal. One is for pre-visit preparations for an upcoming patient appointment. So you've got Luke Skywalker is coming in for his appointment tomorrow. You would want to log into the portal and print this off so that you can speak with the patient about it at their visit. The other time when you would want to log into the portal is for patients on Care Lite. They're going to call the office just like they would for a sick call. And when they call with that symptom change, the portal provides all the details about the patient's baseline and their current symptoms to help support clinical decision making.
So do we have to log into the portal every day?
So the goal is to support your existing workflow, so it's not a requirement to log into the portal. What's most important is that you've got access to this information, including the baseline and the symptoms for decision support. But it is not something where you need to log in every single day, not at all, but it is always available to you.
Great, thanks.
So what we have on the slide here, these are the monthly report of symptom trends and check-ins that are available for each patient. Note that this is a Care Plus patient, so the clinical responses are also included up here. You can see in those columns to the far right on the report. Providers have found that these reports are particularly useful during regular office visits to review with the patient and review the symptom trends over the past few months and any treatment. In addition, this report can be used for documentation for the remote patient monitoring and chronic care management activities.
When will we receive these reports and in what format?
So these are available at the end of the month during the first week of the following month. So patients, as you know, they can check in within any time within a 24-hour period. So they could check in up until midnight on the 31st of the month. So following the close of that month, these reports are generated and they are sent out via secure email or secure fax. They are in a PDF format, so they can be printed, they can be put into a paper chart, and we can work with you to support loading these into an electronic chart if that's what's going to work best for you. So it is always good to hear what other providers have said about the program. This is from a primary care group that found it to be a game changer in their clinical practice. It just helps to keep an eye on the patient in between the office visits. We know that you see the patient today and then the patient comes back either a month or 2 months later, and you never really have good insight into what's going on in between. HGE Care provides that insight into the day-to-day for those patients with minimal impact to the practice workflow. Of course, we're required to cover the indications for use, so I must remind everyone that this is a medical application intended to be used as a support tool for the patients. It is not a real-time monitoring device or an alert system. So we'd like to get started with providing value to your practice and patients as soon as possible. Remember that patients will not receive feedback during their 2-week run-in. In order for us to get started reaching out and getting the patients enrolled, we need some information from you. So in the next week, please review and return the patient listing to us. Review the contents and remember to select Care Lite or Care Plus for each patient.
Hey, Debbie, I'm curious, how much time do I have to review my patient listing?
So generally speaking, we ask that the patient listings be returned within 10 to 14 days so that we can get started, because the next step for us is to generate a patient outreach letter. And we go ahead and we want to make sure that we've got your information back to us as quickly as possible so that the letter can be generated and we can get that out in the mail. Any other questions?
Yeah, I have a follow-up question. Can a patient be moved from Care Lite to Care Plus?
Yes, absolutely. We can move the patient from Care Lite to Care Plus at any time. Patients, obviously the disease progresses, so if you find that the patient is on Care Lite and you feel that Care Plus would be a better fit for them, you just let us know and we go ahead and we update the patient within our system so that the workflows get changed for us.
Just a curiosity, do you send them just a letter or do you do phone calls as well?
So we start off, that's a great question. We start off with a letter and then we follow up with 3 phone attempts to reach the patient. And the 3 phone calls are different times of the day, morning, afternoon, and evening. So we try to catch the patient at a time that works best for them.
Can we enroll patients that we see in the office? How do we do that?
So we are happy to provide 5 patient welcome kits to keep in your office. And when you see a patient that has COPD that would be a good candidate for the HGE Care program, you can give them that kit that has instructions to call our contact center. So within that kit is the patient's peak flow meter, their brochure, a magnet for them to keep all of the program details handy, and also the phone number and the number for us to for them to reach out to us. We also ask that you email us with the patient name and contact information so that we can follow up with them as well, just to make sure that we're all connected together.
Debbie, I'm curious, how long do patients stay on the program?
So we have patients that have been on this program for years, and they really find that it's truly life-changing for them. It gives them the ability to know that there's always they know better, have a better understanding of their disease, but there's always someone watching, as they say. So we have patients that have been on for years. We have patients that have been on for shorter periods of time, but generally speaking, once the patients get on service, it's actually really hard for them to be able to get off because they really feel that it has a lot of added value for them.
That's great, thank you.
Thank you. All right, if there aren't any further questions, you can always reach us at the phone number and the email address that have been provided, and we are always happy to help you out with your COPD patients. Thank you.
Thank you.